name's Debbie Mandela, and I'm a registered nurse here at St. Vincent Charity Hospital in Cleveland. I've been here now for, it'll be 31 years in July, and so obviously I think it's a good hospital, so I'm still here. I pretty much worked in 3 areas in this hospital. I worked in the coronary care unit for about 8 years, and then I was a house nursing supervisor for 3, and then I've been here in the cath lab since 1988. I went to nursing school. I started at Ohio State and then ended up going to Mount Carmel School of Nursing, which is now Mount Carmel College of Nursing. They have their own 4-year thing in Columbus. After Columbus, I came up here and started working at Charity in 1977, and ended up getting my bachelor's science in nursing from Bowling Green. So that's my education. But as far as working here in the cath lab, which I've been here, like I said, 20 years now, which is hard to believe, it was basically twofold. First part of it was that you needed to have intensive care experience, which I had all my coronary care experience, so you could read all the pressure lines and understand a lot of the medications, emergency medications. The rest of it was on the job training as far as doing it, assisting the physician with a cardiac cath itself and learning all the equipment, which there is a lot of equipment to learn, and something new coming out all the time. We're in cath lab room number 3. Just want to show you that I don't wear jeans in this when we work in here. All members have to wear scrubs because we want to, it's a sterile area, but it's also more aseptic than sterile. It's not like exactly like surgery. This is a procedure room. It's not major surgery. We don't really do any cutting as far as cardiac caths go. These cannot go home. We have to come in our clothes, change to these, then take these off at the end of the day, and they get thrown out, and they're not thrown out, but laundered by the hospital. And we do that every day that we come into work. So usually we're dressed in blue. But this is where we do heart catheterizations. The patient lays over here on the table. This room has a weight limit of 350 pounds. Our other rooms have different weight limits. We're getting a new room, and the weight limit's going to be, I think it's 540, because due to the large and surgical obese patients, we need a heavier weight limit. With any procedure, we don't have it turned on right now, but there is a defibrillator over here. Defibrillator in case it does happen, but very rarely that a patient will go into a regular heartbeat that we need to defibrillate them out of that to get them into regular rhythm. The patient is always hooked up to a heart monitor, which shows up here. So we use these, and with the electrodes, we hook them up to a blood pressure cuff, which you can't see, but where this says peripheral monitor data, that's where a blood pressure would show up. And all of the pictures that we take would show up on these 2 TV screens. Usually the middle one will be the live screen, and then we can save pictures on the left one. There is one little aspect of the cath lab that is trying at times, is being on call. Part of the cath lab is being available for an acute coronary syndrome or heart attack at any time. So we always have a team of 3 that are on call. We have to be able to get to the hospital within 30 minutes. We're supposed to be able to get the patient from the door of the emergency room up into the cath lab, and with the balloon inflated within 90 minutes. That's the standard of care that they're trying to do right now to get blood flow going to that heart. So it is a good profession. It's nice to see people get better and feel better. They come in with the worst chest pain, scale of 1 to 10. 10's the worst. They have a 10 coming in, and when we're done with them, they have a 0. So that is a nice thing. I'll be there when your heart stops beating. I'll be there when you're